cancer surgery is considered like a very integral aspect of cancer treatment. पर कई बार पेशेंट्स आते हैं डायग्नोसिस के बाद में एंड दे हैव अ वेरी टिपिकल क्वेश्चन विच दे आस्क कि इसमें सर्जरी तो नहीं लगेगी.
Make sure that we have removed or taken away 100% of the disease, not 99%, not less than that. So even at the microscopic level, जो आंखों से नहीं दिखता है वो भी हटनी चाहिए body से. And that is the reason, or that is the only way that we can attain cure. अगर कुछ रह जाते body में तो वो बीमारी वापस आना ही है. Surgeon is controlling the robot. It's a master slave relationship. रोबोट अपने आप कुछ नहीं कर सकते हैं. जब तक सर्जन नहीं बताएंगे तब तक रोबोट कुछ नहीं कर सकता है. HIPEC is in which we remove all the tumor which is spread across the abdominal cavity. It could be creeping along the surfaces of the abdomen, and in the past that was considered to be incurable. We then can place a catheter into the liver, to the hepatic artery, and place a pump onto the abdominal wall, and then instill high doses of chemotherapy directly into the liver. So this is a very novel technique, and it's just recently come to India. आजकल patient demands a super specialist. In fact, cancer में भी patient पूछते हैं कि आप colon cancer specialist है क्या?
हेलो एंड वेलकम टू गुड बेटर ब्रेस्ट. आज हम बात करेंगे कैंसर सर्जरी के बारे में, सम बेसिक एंड रेलेवेंट एस्पेक्ट्स ऑफ कैंसर सर्जरी. एंड फॉर दैट वी हैव विद अस a world renowned, passionate, and compassionate cancer surgeon, a trailblazer for many complex and advanced cancer surgery, Dr. Vinay Samuel Gaikwad, uh, Director Surgical Oncology and a GI and HPV specialist. Welcome, sir, and thank you for accepting our invitation.
It's my pleasure, and I was hoping you were talking about me during that introduction.
Yeah, so it's an honor to have you on board on discussion about cancer surgery. So before cancer surgery, let's talk about how to find the right doctor for cancer surgery. So पे बहुत common confusion होता है amongst the family and the patient to reach the right specialist for cancer surgery. So for those who are struggling to find one, what is your advice about it?
So cancer as a diagnosis, unlike other specialties or other diseases, is usually a surprise. काफ़ी बार हम सोचते नहीं कि हमको कैंसर हो सकता है या हमारे फैमिली मेम्बर्स को कैंसर हो सकते हैं. So it is a shock initially. To come out of that shock, it takes some time. And the most important thing to understand is a cancer specialist will not diagnose your cancer. Unlike other conditions like गैस्ट्रो के प्रॉब्लम है तो गैस्ट्रोएंटरोलॉजिस्ट डायग्नोस करेंगे आपको. आपका गॉल स्टोन है तो सर्जन डायग्नोस करेंगे आपका गॉल स्टोन्स. But in cancer, it is not the cancer specialist who diagnoses your problem. So therefore, the patient then comes in a dilemma as to now I'm diagnosed with this cancer. The family comes into this problem. I've been diagnosed with cancer, but now where do we go to actually get treated? And which is the best doctor, which is the best hospital or institute to go to for this condition? And that is a very important topic to discuss, because many times the patient is misguided based on various kind of myths or preconceptions that they might have. So my suggestion is once you're diagnosed with a cancer, which I hope none of us have to face, but unfortunately, if we do have to face this problem, it's important to take some time to understand and come to terms with the fact that yes, to accept the fact that you have cancer is itself a very difficult proposition, because many the denial phase is the first psychological part of that process. Once we come to terms with that, the fact, yes, we accept that yes, this is in fact a cancer, now we need treatment. Let's go to the proper specialist to deal with this. So many times your referring doctor, the doctor who diagnoses it, can help you decide where to go. More than that, there's everybody goes to Google, everybody goes to the internet, looks at doctors in their area. For cancer, people travel everywhere throughout India, throughout the world. People are ready to go to get what they think is the best treatment for that specialty or that disease. So we should not get misguided. Just because someone's on the top of the, let's say, Google page, doesn't mean they're the best in that specialty. There are many reasons they could be at the top. So it's good to kind of look at it in a wholesome way. Good to ask your doctors, your peers, your family members. It's all fine. So everybody can contribute to how you make a decision. It's not necessary. So if you can, there could be financial issues. So even government institutes are good to go to for cancer. The problem might be longer waiting periods. So if you're ready to deal with that issue, it's fine. There are a lot of private centers that are doing good cancer work. It is good to have comprehensive cancer care. Most cancer treatment should be under one roof. That would be a better situation. And another thing I would add to is that it's good to go to that specialist of that particular organ system of that cancer. So, for example, if it is a breast cancer, seeking a breast cancer specialist would be something I would advise, because that would be a slight edge ahead in terms of the treatment that you would get.
So, especially about some cancer, like complex procedures, it depends if the institute or the surgeon is doing in high volumes. So, that makes sense to go to a person who is organ based and specialized in that particular field and doing that kind of complex surgeries day in and out.
So volume is an important part. Also, the basic finesse, the expertise, training कैसा है इनका, what are they used to doing this particular type of work more often. The difference क्या है कि the results will be better, outcomes will be better, complication rates कम हो जाएंगे, uh, quality of life better हो सकता है. तो इसलिए organ specific is something कि हम सोचते हैं कि that is a good way to approach the situation.
So, cancer surgery is considered like a very integral aspect of cancer treatment. पर कई बार पेशेंट्स आते हैं डायग्नोसिस के बाद में एंड दे हैव अ वेरी टिपिकल क्वेश्चन विच दे आस्क कि इसमें सर्जरी तो नहीं लगेगी. सो वी एंड अप एक्सप्लेनिंग टू देम कि अगर आपकी कैंसर की सर्जरी हो रही है या हो सकती है, पॉसिबल है, दैट मीन्स यू आर अमेनेबल टू बेटर क्योर्स एंड अ गुड रिजल्ट आफ्टर दैट. सो वो एक फियर जो है कैंसर सर्जरी का, या कैंसर सर्जरी तो नहीं लगेगी, दैट इज समथिंग विच वी हैव टू डील विद इन एंड आउट.
Yeah, so there are two types of cancers. एक तो blood cancers होते हैं और एक non-blood cancers, or what we call solid organ cancers. So in solid organ cancers, without surgery, it's very difficult to get a cure. बहुत कम cancers है in which you can get a cure without surgery. So if a doctor is suggesting surgery to you, that means it is curable. You most of the time. तो ये रिवर्स थिंकिंग है. पेशेंट्स होते हैं कि अगर सर्जरी तो नहीं लगेगी, इफ सर्जरी दैट मीन्स अ बिग प्रॉब्लम, बट इट्स एक्चुअली द रिवर्स. अगर सर्जरी लगती है दैट मीन्स इट इज क्योरेबल. द पेशेंट्स हु आर नॉट क्योरेबल एडवांस स्टेजेस में, उसमें सर्जरी यूजुअली लगती नहीं है. वी कैन नॉट बेनिफिट द पेशेंट फ्रॉम सर्जरी, एंड देयरफॉर अदर ऑप्शंस सच एज कीमोथेरेपी एंड सो ऑन, इम्यूनोथेरेपी, टारगेटेड थेरेपी कम इनटू प्ले, क्योंकि ये ठीक क्योर नहीं हो सकते, ये कंट्रोल कर सकते हैं बीमारी को. So surgery is actually a very good news. If a doctor is telling you कि surgery हम करेंगे, that means you are in a positive kind of stage in which you can get a high chance of a cure, a potential for cure.
So, like, we have the intent of our treatment. So, with surgery, it becomes a curative intent.
Exactly, it's a curative intent. That's a very defining part of the whole cancer treatment. Whether the intention is to cure or the intention is to control, that's the first thing we have to understand.
So, if a patient can undergo surgery of cancer, it's actually a good news for them.
Exactly what I'm trying to convey.
So, very important aspect of the cancer surgery is how the cancer is removed. Like, there are some special ways or techniques of removing the cancer which is different than the other surgeries. So, there are some principles of cancer surgeries which have to be followed for removing that cancer.
So cancer surgery is different than any other type of surgery. That is why it's important to go to a cancer specialist when doing a cancer surgery. Because what's important is for us to make sure that we have removed or taken away 100% of the disease, not 99%, not less than that. So even at the microscopic level, जो आंखों से नहीं दिखता है वो भी हटनी चाहिए बॉडी से. And that is the reason, or that is the only way that we can attain cure. अगर कुछ रह जाते बॉडी में तो वो बीमारी वापस आना ही है. ठीक है. So that is the thing. So surgery can be done in many ways. The conventional way is the normal चीरा लगा के, incision लगा के. That can be the way, and that even today one of the common ways to perform cancer surgery is through an incision, which can be a little cumbersome, it can be cosmetically displeasing. But when we're facing with cancer, it's a life or death situation, so that is still worth it. But there are minimally invasive techniques that are used now, including laparoscopy, thoracoscopy, and endoscopic techniques. But now, what is more kind of coming into mainstream is robotic surgery. So the robotic surgeries are playing a main role in cancer treatment. Even as we speak, it's getting more and more popular, and it's popular because it is benefiting patients. It's not a hype. It's not a gimmick. The surgeon is completely in control of the robot. It's
That's
not.
a very common question which patients have कि robot perform करेंगे क्या surgery?
हाँ जी, तो the surgeon is controlling the robot. It's a master slave relationship. रोबोट अपने आप कुछ नहीं कर सकते हैं जब तक सर्जन नहीं बताएंगे, तब तक रोबोट कुछ नहीं कर सकता है. So that is how it works, and it is benefiting the patient by having a better organ preservation, right? What I mean by that is जो organs हमारे body में है, वो पहले सब कुछ निकालना पड़ता है. जैसे फुल पैंक्रियाज निकाल दो, या फुल रेक्टम निकाल दीजिए, या फुल किडनी निकाल दीजिए. But in with robotic systems, we are able to get a better organ preservation. That means cancer is fully out, but the organ can be preserved in some way, which is a very important thing. In addition to the other advantages like lesser pain, faster recovery, lesser blood loss, all of those have been proven time and time again. In addition to this, there are non-surgical techniques which have our procedures, such as cryotherapy, radiofrequency ablation. These can burn or freeze tumors without actually doing any proper cutting or any surgical procedure. But these are considered intervention procedures, which are also uh, valid for some tumors that we can offer these treatments.
And there are many novel and innovative techniques which also you do, like instilling the chemotherapy inside the body while operating.
Yes, so uh, something that is really revolutionizing abdominal cancers, especially advanced cancers, is something called HIPEC, which is hyperthermic intraperitoneal chemotherapy, and also another treatment called PIPEC, which is more palliative. So HIPEC is in which we remove all the tumor which is spread across the abdominal cavity, which it could be creeping along the surfaces of the abdomen. And in the past, that was considered to be incurable, कि हम निकाल ही नहीं सकता, ये पेशेंट का क्योर पॉसिबल ही नहीं है. But with this treatment called HIPEC, we're able to do very major surgeries to remove all the tumor we can see with our naked eye. And then for the microscopic tumor that we might have left out, we then instill heated chemotherapy at 43 degrees Celsius for roughly 90 minutes, and that goes and kills any microscopic cells that might be there in the abdominal cavity through direct contact. So that is called HIPEC. That is really uh, helping to increase survival, decrease recurrence rates, increase quality of life for many patients with advanced abdominal cancers. So that is something that more people should be aware about. A lot of centers are not doing it still, and many times we get patients who say that we didn't know that this treatment existed. We would have preferred to get this treatment if we knew about it.
So we are actually removing the tumor which we are seeing through our eyes, that is gross tumor, but also the microscopic, the cells which might be left behind, and killing it with heated chemotherapy by this technique.
Yes.
And when it is done in a more palliative setting, that is PIPAC.
So PIPEC is a laparoscopic procedure without any major incisions, but it is done for patients who cannot be cured, in which chemotherapy, which we give through the veins or through tablets, are not working anymore. And there's a lot of ascites, which is water collected in the abdomen. पानी बार बार निकालना पड़ रहा है, वो ठीक नहीं हो रहा है, कीमोथेरेपी इफेक्टिव नहीं है. For those type of patients, we can offer this treatment called PIPEC, which is pressurized intraperitoneal aerosol chemotherapy, in which the liquid chemotherapy is converted into a gaseous form and sprayed into the abdominal cavity for around 30 minutes. And this can again sediment and kill the cancer cells through direct contact, therefore decreasing the chance of ascites development, and also shrinking the tumor, delaying obstructions, delaying other problems related to the cancer growth.
So chemotherapy otherwise is given in the bloodstream, injection देके, and then it goes to the cells and kill the cells. But ये जो chemotherapy है HIPEC में and PIPEC में, it's with direct contact to the tumor and killing the cells.
So this
Yeah.
is called a it's a different method to give chemotherapy. In the past, it was thought that chemotherapy can only be given through the bloodstream या tablet form में.
Hmm.
बट इस ट्रीटमेंट में हम डायरेक्टली पेट में या इवन चेस्ट कैविटी में दे
Hmm.
सकते हैं
Hmm.
कभी mesothelioma
Hmm.
and some other diseases which affect the lung and pleural cavity also can be given chemotherapy directly, and heating the chemotherapy helps to augment the penetration of
Penetration
the
of it.
chemotherapy.
सो कैंसर रिमूवल में तो कैंसर सर्जरी हेल्प करती ही है, बट कीमोथेरेपी को अलग अलग तरीके से एडमिनिस्टर करने में भी सर्जिकल अप्रोचेस हैं, एंड सिमिलरली कुछ टारगेटेड अप्रोचेस भी होते हैं, लाइक वी कैन डायरेक्टली गिव कीमोथेरेपी टू द पर्टिकुलर ऑर्गन.
Yeah, so one of the good examples for that is a hepatic artery infusion pump. तो इसमें क्या है, जब फॉर एग्जांपल कोलन में कैंसर है, रेक्टम में कैंसर है जो लिवर तक स्प्रेड हो चुके हैं, द प्राइमरी और द स्टार्टिंग पॉइंट इज इन द कोलन बट इट हैज गॉन थ्रू द ब्लड स्ट्रीम इनटू द लिवर, एंड वो ऑपरेशन नहीं हो सकता, लिवर में दोनों साइड, लेफ्ट राइट साइड में दोनों साइड में बीमारी है. सो व्हाट वी डू इज वी then can place a catheter into the liver, to the hepatic artery, and place a pump onto the abdominal wall and then instill high doses of chemotherapy directly into the liver. So this is a very novel technique, and it's just recently come to India, and with this we are able to completely uh, we expect to completely dissolve all the tumor in the liver, and if anything is left behind we can then go and to perform an operation to remove that part of the liver which is affected by the cancer.
So the take-home message for our viewers here is cancer surgery early cancer stage में तो हमें पता है कि हम कर सकते हैं, but even in advanced cancers there are a lot of surgical approaches and surgical solutions available for such patients even when they have advanced diseases.
Yes, so contrary to what we were saying earlier, in the past, only stage 1 or stage 2 or maximum stage 3 cancers could undergo surgery and think of a cure. But now, in certain cancers, even in stage 4 cancers, we can think of doing surgery and do procedures to help patients with advanced cancers through surgical techniques, not just chemotherapy or immunotherapy.
सो ऐसे मेजर सर्जरीज जब आप प्लान करते हैं, सो देयर इज लॉट ऑफ प्री ऑपरेटिव प्लानिंग व्हिच हैपेंस बिफोर सच पेशेंट्स आर टेकन इन, एंड कोई सर्जिकल कोई चेकलिस्ट होती हैं, या हाउ डू यू प्रोसीड?
So just like how pilots before taking off they have a very strict checklist uh, to prevent any accident or any adverse condition. Similarly, surgery is very much like taking an aircraft up. So हम पहले तो obviously we get a lot of tests done, investigations होते हैं, CT scan, PET scan, biopsies, बहुत सारी चीजें we have to double check that कि वो सब हो चुका है. It's not in the past काफी बार होता था कि जैसे पेट खोल लिया है, कोई पार्ट खोल दिया, फिर पता चला कि ये निकाल ही नहीं सकते हम, फिर बंद कर दिया. तो दिस इज getting less and less prevalent because of good uh, investigations, improvement in technology. All of those things are helping us to prevent these type of inoperable situations or conditions which will adversely affect the patient.
To reduce the surprises
Yeah,
during the
so we
surgery.
hardly get any surprises now because we have very good radiology and nuclear medicine and other tests which help us uh, know precisely what's happening. Although there's still a margin for error, but it's very much less than in the past. Also, obviously, every hospital has a checklist before doing an operation. Patient सही है, वो भी कभी-कभी गलत हो सकता है अगर हम ध्यान नहीं देते हैं. Left side, right side, सारे preparations complete है कि नहीं. Every hospital, every good hospital will have those checklists in place. We have a what we call a pre-op surgical checklist, which we always follow for every patient, and I'm sure everybody in all accredited hospitals are following this practice of a surgical safety checklist. So that is something that cannot be avoided to ensure quality and ensure all patients get the best care possible.
सो फ्रॉम पेशेंट्स पर्सपेक्टिव, बिकॉज एक बार कैंसर डायग्नोसिस के बाद में दैट the clock starts ticking, and what they need to understand is that it's a very informed and a well explained and well planned procedure which is happening, and एक दो दिन में एक हफ्ते में it doesn't make any difference, but it has to be well evaluated and well planned before going in. And patients should be admitted maybe a day prior, and all the tests and all preparations need to happen before they go in for surgery.
Yeah, so we should prevent unnecessary delays. बिना बात के पोस्टपोन करने की मतलब नहीं है, because the cancer does increase with time. But ऐसे नहीं कि पैनिक मोड पे कोई डिसीजन ले लिया. You can take a few days or even a week or more than that to think, like you said, to plan and to decide where you want to get the treatment, how you want to get the treatment, other opinions you have received, something you agree with. You can take time to decide all of those things.
So, is it easier if the patient understands what they are going through, the type of complex surgeries which you do? If the patients really understand what you're doing, it becomes easier. Or when they say that okay, they don't understand anything and they want you to do take charge of everything. How do you want your patients to be well informed or
Well,
not?
that's a personal choice. So for me, I prefer my patients to be totally informed, and that is how it usually happens nowadays. Most people have looked up Google, have checked everything there is to know about that cancer, everything there is to know about you, to be honest. And so that is much better for us, because if the patient is aware of what the condition is, क्या treatment options है, क्या possibilities है, it's easier for us as oncologists to explain the next step to them, and so they understand it better. A person who comes ill informed, हर चीज सरप्राइज होते हैं इनके लिए, वो डाइजेस्ट नहीं कर पाते हैं, क्या बता रहे डॉक्टर साहब ये तो, एंड सो दैट बिकम्स वेरी डिफिकल्ट टू get the best treatment forward and for the patient to be convinced, because these are complex situations, complications be possible hai, we might not always get the desired result that we are expecting. So the patient should be aware of all of those things, and it is better for patients to be pre-informed before they come to the oncologist, that they have a baseline kind of level of understanding before they come to you.
So, something about being surgeon, how you decided to choose cancer surgery as your profession, and you have been a team leader for 10 years now, and you have a team of surgeons under you. So, uh, if you can share your journey about this.
That's a personal story, and everybody has their own story, I'm sure. Uh, so, as you become a doctor, then you have to make a choice about what specialty you want to do. So, initially, like most of us, it was cardiology and those other more attractive specialties. But as you develop your own personality as a doctor, I realized that I want to be a man of action. So surgery was the obvious choice. So you want to do something with your hands, you want to do something mechanically that actually makes a difference to the patient. Writing medicines is something that, yes, it's fun for many people, but that's not something that we
very relatable to
that we relate to much. We want to do something actionable, and because of what we do, so another person gets benefited. So that was a very attractive concept to me, that I could actually make a difference to people's lives through something that I've done. So that was where we took up surgery. Now, surgery, as you know, is a very difficult residency program. It's very physically demanding, mentally demanding, and most importantly, psychologically very taxing to most people. It's not for everybody. Surgery cannot be handled as a specialty by most people, I would say. And once you take up surgery and you got the concepts of principles of surgery in your uh, daily working habits, then it's a question about selecting or not selecting a super specialty. It's not necessary to go ahead with it, but हम कर सकते हैं. It's a good idea. And आजकल patient demands a super specialist. In fact, cancer में भी patient पूछते हैं कि आप colon cancer specialist है क्या? So that is something that the patient is now being aware about, and then therefore we are supplying the demand that is there. So I always liked GI or gastrointestinal surgery in such, especially HPV, which is hepatobiliary surgery, and pancreatic surgery. Also, colorectal surgery was quite interesting. So as I went into GI surgery, then I realized that the place that I could make the biggest difference was in oncology. Therefore, I did my GI oncology training in Tata Memorial Hospital in Mumbai. which is the premier institute for oncology in our country. And that was an excellent time that really showed me how to, take things forward in the right way, how it should be done, the appropriate way. And after that, yes, I realized to survive or to make a real difference, it's not a solo practice that is something that will be the future, but a team practice and an organ-based oncology practice. Therefore, like, we have teamed up with other specialists in other organ systems, like you doing breast cancer, uh, and head and neck cancer, gynae cancers, and so on. So we have built a team, which is not an easy task because a lot of differences might arise both professionally and personally. So maintaining a team is not an easy task, as most people know. So team building is something that requires a lot of thought, a lot of sacrifice as well, and a lot of understanding. And leadership is something that is not, you can't lead from the front, it's something that you push from the behind. So you make sure everybody in the team is well taken care of, fulfilled, and the future prospects should be something that everybody is looking forward to, because there has to be growth for everybody in the team. So that is how I look at it, and I hope that we can serve patients better uh, as we do now, and even more, fulfilling in the future with the team that we have. And we can also expand the team as we go along, as we see fit, and ultimately the benefit goes to the patient in who we serve. So the patient is the main, uh, the star of the show is a patient, and they're the ones that we want to really put in the forefront of everything that we do. And anything that we strive for should ultimately result in the patient benefit.
So the patient is getting actually a team of specialized surgeons and doctors to take care of them.
Mhm.
So that is what the patient receives at the end.
Yeah, so it's not about being top to bottom, but it's everybody in the team has a role to play, and that's important for people to understand. Many people go for, let's say, star doctors, and then there might not be anybody else in the team who deals with them on a daily basis. When there's an issue, when there's a problem, who do we contact? Who can we approach? So all of those things have to be taken care of, and I feel that in our team we have those things in place. There are people to contact at every level for any problem, from dressings to medication related problems to any simple issues like pain or vomiting or anything it might be, that has to be addressed in the right time, and tackled so that there won't be any major issues.
So the cancer surgery is like a very complex or advanced surgery, and it's a long procedure. It's a long the patients which are connected with us for a very long time, because the course of treatment, which includes sometimes chemotherapy before surgery and sometimes after the surgery. So such patients require constant care and tackling of the situation. And when you have a team which can manage all of that, it becomes very easy for the patient as well. And rather than being a very one man army kind of a surgeon, it's not advisable, especially in complex surgeries like cancer.
And so it's teamwork that makes the dream work. So that's a slogan many people use, and it's a very important methodology to achieve a much larger picture that you have in mind, the dream that you have. The team can accomplish that, not a single person.
So it has been a very insightful and valuable discussion so far. So any concluding words from your side?
So it was great discussing a very important topic with you today about cancer and its treatment, and how a patient can approach this problem, which is a very difficult task, and it can be very challenging. So I hope this video has been insightful and helpful to many people who are in this dilemma. And we hope that you can have more such videos in the future to help public awareness for a lot of health issues that are prevalent. There are a lot of myths that need to be busted about these type of issues like cancer and other diseases.
Thank you for patient listening, and hope we were able to decode some of your myths and dilemmas about cancer surgery, कि कैंसर सर्जरी क्या होती है, क्यों ज़रूरी होती है, एंड कैसे राइट स्पेशलिस्ट से मिल सकते हैं. न्यूअर टेक्निक्स जैसे रोबोटिक्स है या हाईपेक है, कैसे हम और किन पेशेंट्स के लिए ये बेनिफिशियल है. So stay tuned with us, and if you have further questions, queries, or any suggestions regarding our podcast, please feel free to write in the comment section. Thank you so much.